تعبي سحبت ما قدرت. بس بس لو سحبت ما أقدر.
Hello, everyone. Can someone confirm if you can hear me well?
Hi, Sawsan. We can hear you loud and clear.
Great. And can you see the screen?
Yes, we can see the screen and we can see you.
Okay, great. So we will wait for around 4 minutes or 5 minutes, and we will start later. Thank you. Hello again, everyone. I believe we can start now. It's almost 4 o'clock, 1 minute. So let's begin. First of all, I would like to thank you all for joining today. And I'm also very happy to participate in this initiative to raise awareness about autism in Autism Awareness Month in April. And today I'm going to talk about introduction about Ayres sensory integration. I have chosen this topic specifically because it's very common for children with autism to have difficulties in sensory integration and to have sensory processing difficulties. So actually the research shows that around 60 to 90% of autistic children have sensory processing disorder as well. Sensory processing disorder can happen also without any other disorder. It could happen alone, but it's also very common with autistic children. And before we start today's presentation, let me briefly just introduce myself. My name is Sawsan Sharf. I'm an occupational therapist and I'm certified in Ayres sensory integration. I have worked with kids since around 10 years. I have experience with different cases with autistic children, ADHD, and other diagnoses as well. So let's begin.
Hello, Sawsan. Could you please just unmute yourself? We cannot hear you.
You didn't hear anything, guys?
No, you were muted, Sawsan, but now we can hear you.
Sorry. It's okay, it's okay. So let's begin, guys. Thank you so much for your participation. I'm very excited
Yeah,
to...
we heard this and we heard the introduction and you introduced yourself. It's just after your introduction to yourself.
Yeah, sure. So let's start now with today's objectives. Today we're going to define what sensory integration is. We will introduce the sensory systems and identify sensory processing disorders. And also we will discuss OT strategies to support the children's participation. And actually, I have another aim from today's presentation. I think someone is unmuted. Can you please mute yourself? So the other aim from this presentation actually is to shift our mindset about children with autism and looking for their behavior as only behavior. Because actually most of the behaviors that we're seeing with children with autism, or not only autism or other diagnoses, it's not only because of the behavior or because the child doesn't want to listen or doesn't want to participate, but it's actually because there are some more deep reasons. It could be from sensory integration and how they receive the input from the environment. And the other aim from today's presentation is also to increase our collaboration, because we are, as a therapist, even if we did our best, if we did whatever we know with the child, it's not enough. We have to collaborate as a parent, as a teachers, as a therapist, to work all together to support the children's participation. Let's begin with the definition of what is the sensory integration. So sensory integration is about how the brain receives the information from the environment and from the body itself, how we organize these inputs and how we respond to these inputs. So it's like 3 phases. First phase, receiving information from environment and from body. The second phase is about how we organize and how we process this information, and finally, how we react to it. And actually, this process isn't easy and isn't like a simple simple thing to happen with the kids. I'll give you like an example just to understand how complex this process is. Now, generally, in each moment in the day, we are receiving a huge number of sensory inputs from the environment and from our body. And it's like a loop. It's happening again and again and again at the same moment. For example, now, while I'm sitting here, I'm receiving different like inputs about I'm sitting on the chair, I'm looking at the screen, the weather is warm, for example, receiving information about the texture of my clothes, and also I hear some background noise. But my brain in normal situation has the ability to choose the thing that I want to focus on and the thing that I want to respond to. And at the same time, I can ignore the other sensations. But if there is any problem with this process, the child will not be able to sort out this information or just separate it from each other. It will be like a mess in the brain. All sensations are coming together, and the child cannot choose one thing to respond to it. So, what is sensory integration theory? This theory is created by Dr. Jean Ayres in 1972. This doctor was an occupational therapist and also a psychologist. She thought that the sensations are like affecting our behavior and also our learning. So what she did is that she studied the brain and the basics of behavior. She integrated knowledge from neurology, psychology, and education. She developed assessments and she tested many children, typically developing and atypical developing. She created intervention methods and she noticed that there are a consistent patterns for sensory integration and development. So if the sensations are working well and integrating well, the child can develop naturally. But if there is any problem with sensations, that really affecting the behavior and the learning as well. So sensations is nourishment for the brain. It's like a fuel for the brain, exactly like we eat and we take food to develop our bodies. We need the sensations to develop our brain and to learn as well. Sensory information necessary for the brain function generally, but both extremes, that too much information and too less information could stimulate a problem for the children. The sensory deprivation, I'll give an example here about the pandemic. Last pandemic, when the children were sitting at the homes, they didn't like interact with other children. They were spending so many hours on the screens with sensory deprivation because actually they are not like interacting with the environment, right? So after this period of pandemic, children were like very not attended, very hyperactive. Their learning was affected as well. A lot of things happened after this pandemic because of the less sensory information and less sensory like nourishment for the brain. And if the sensations are too much, it's also a problem. I'll give another example here about overstimulating environments. For me personally, I think the wedding parties are one of the most like overstimulating environments because there are so many things happening at the same time. Everything is intense in weddings. The lighting, the songs, too much people around you. So usually after weddings, I feel like headache. It's too much for me. And in busy environments, generally, where you can see a lot of sensory inputs around you, it's not easy to handle that. So balance is the key from sensation. We have to interact with the environment properly just to nourish our brain. So here I want to explain this pyramid for you. It's called the pyramid of learning. I want you to look at the base of this pyramid. It's the foundational skills. the central nervous system and the sensations are the basic skills for building any new skill or to learn anything. So if the sensations are not working well, that definitely will affect the other skills, the more complex skills. If we move from the sensations up, we will go to the sensory motor skills. Sensory motors, that means the body scheme should be like identified for the child. The child should identify the both sides of the body, right side and left side, the motor planning, the postural control. After these skills, we're moving to higher level, and here we are implementing the motor skills with the perceptual skills. So the child will learn how to coordinate the eye with the hand, coordinate the eye with the foot, and adjust the posture and do the visual skills like ocular motor control, scanning, and screening items with eye as well. And at the tip of this pyramid, we have the cognition skills, which are the learning and participating in daily activities, and also the behavior. So what's important in this pyramid is to identify if there is any difficulty in behavior or academic learning that we have to go down to the base of this pyramid. We cannot just intervene directly to try to treat the behavior or treat the learning skills. We have to go down and make sure that every single stage is mastered to the child. So I want you here all to look at behavior, but think sensory. We have to go down to understand what is happening with the kids. Now I'm going to talk about the sensations. Actually, every one of us is very familiar with the five senses, the vision, hearing, touch, smell, and taste. But we have three more sensations in sensory integration theory. First sensation is the interoception system. This system helps us identify what's happening inside our body. Like, for example, if you are hungry, if you are like thirsty, feeling full, if you need to go to sleep, or if you need to go to toilet. And we have also two further sensory systems in sensory integration theory, which are the proprioception and vestibular. Proprioception system, I will just explain it very briefly and simply. Now, in our muscles and in our joints, we have sensors. These sensors and receptors are sending signals to the brain to inform the brain where is your body is located right now, without relying on the vision. If, for example, I closed my eye now, and if I raised my hand, I can know that my hand is already raised, even though I'm not looking to that, because of these receptors. It's moving the information to the brain. And the other sensation is the vestibular system. Vestibular system is available in the inner ear. It's a very small system, which is responsible for movement detection and our balance. If I asked you now just to raise one leg and stand on one leg, the system will help you to balance yourself is the vestibular system. And if you closed your eyes, you will find that much harder because your vestibular system is trying harder to just keep you balanced. One more example here. If you went to the elevator and you went up or down, you will know that, even though if you don't know like in which floor you're going, because your body is informing that you're moving up. So it's like the movement detection system in our body. So sensory processing disorders, we have different disorders: sensory modulation, sensory-based motor disorder, and sensory discrimination disorder. But what we will focus on today is sensory modulation disorder because it's the most common one. So what is sensory modulation is? Sensory modulation is the brain's ability to respond to input in appropriate and balanced way. So we will receive the information, We will process it and respond just right to this information. But what if we overreact or underreact to this sensory input? That means we have sensory modulation difficulties here. So in this table, we're going to explain two different terms or concepts. The first one is the sensory threshold or sensory reactivity, and the second one is how we respond to this input and how we do the self-regulation. In order to explain this better, I will just go here. I want you to look to this picture. This cup is medium-sized cup. We have the filled water inside it. This picture is describing or representing the optimal sensory sensitivity threshold. So if we filled this cup with water, the water here represents the amount of sensory input. So if it's filled, it will touch and trigger something called sensory threshold. Once it's triggered, it will just send information to the brain to respond to this input appropriately. So one easy example for this picture is like if someone called me, Sawsan, okay, I heard this input, I will respond to it in appropriate way. Yes, tell me, what do you need? What do you want? That means everything is working well. But what's happening in sensory modulation difficulty is that sometimes the cup is bigger than the normal. That means the sensory threshold is much bigger than the other kids or the other people in this age group. So look at the amount of water, which is the amount of sensory input. It's not enough. If it's not full, that means that it's not enough. It didn't trigger the sensory threshold. So here the child will react in two different ways. It's either active response or passive response. The active response, the child will try to add the water to himself. That means he will try to add the sensations to himself in order to feel more regulated. For example, if the child is seeking extra movement than other kids, it's not because he just want to move or just he want to disturb others, but because he's not feeling his body and he need to be regulated. And that's why he's trying to seek the input to feel himself and to feel better. And what about the passive way? If the child didn't seek the information, simply he will not notice the information. He will not register it. If I called one child, for example, Isa, I might ask him one time, two times, three times, and he will not respond. Not because he doesn't want to respond again, but because he didn't register that information. So remember, if the threshold is high, that means the child needs higher amount of input to be regulated. Okay, what about if the cup, the sensory threshold is small? If I put the natural amount of water or natural amount of sensory input to this cup, actually it will exceed. It will be overwhelming to the child. It will be very hard to interpret and to accept. So again, we have two ways of responding to this information. It's either active or passive. The active way, the child simply will avoid the sensory input. Sometimes we notice a lot of children like running out of the class, not because they want to run, but because maybe they are overwhelmed with the amount of sensory information in the room or in the environment. That's why they are trying to escape. What if the child didn't react actively and react passively? He will still be sensitive. He will not be happy. He will be like discomfortable, but he will not like react intensely to this difficulty or to this issue. So I think you understood here what sensory reactivity is. So sensory reactivity in our life, it's responsible for our pleasure or our aversion. That's why some children will seek some specific activities, playing with the sand, playing with Play-Doh, running, spinning, and a lot of different things. And that's why other children will be aversive and will withdraw from the environment because they have different sensory reactivity threshold. And also, it will affect the activity level, definitely. Some children will seem very hyperactive, and some children will be like, or they will look like a lazy children, even though they are not lazy, but because of their sensory processing. It will affect the attention, definitely, because in this situation, the body will work hardly just to be regulated. The main target for the body in this case will be just to regulate the sensation, not to go for more complex activities or more complex skills. Also, definitely, it affects the emotions. Continuum, that means that sensory reactivity isn't fixed all the time. Even if the child has a specific pattern, it will not be the same all the time. Sometimes the child will be like overstimulated, sometimes will seek further information and seek further stimulation. It depends on very different things. And also, it will affect the social interactions because if the child, for example, hates the light touch, it will not easy to play with other kids or to go to participate for the outdoor areas, for example, because a lot of things happening there. So definitely they will just avoid to be in social gatherings. So here I want you to do all a brief reflection about yourself actually having different sensory reactivity levels and different sensory thresholds is a very normal thing for every one of us. Every one of us has a specific preferences and some sensations that we're not happy with or we don't accept it. So I'll be very happy if you shared your sensory preferences here in the chat. For me personally, for example, I really love to cover my body in a heavy blanket. I feel very satisfied with that. Also, another thing that I hate the darkness. I don't like to be in the dark places. I always love the bright colors and the places where it's like more shiny. So generally, we have the three most important sensations in our body. It's first the proprioception, then the vestibular, then the tactile. Because if we think about it, most of our daily activities will let you be in need to feel yourself and your body and also to be like more balanced and coordinated. And finally, the tactile is very important because everything we're doing in life, we're using our hands. Dressing, feeding, playing, everything literally we are doing with our hands. So if there's any difficulty in the tactile, which is the touch sensation, it will be very hard to accept that. So let's start with the proprioception processing differences. First, the proprioception is the most important system, as I already mentioned. It's the most regulating system in our body. If I'll give you example from our daily life, if, for example, you felt some headache or you felt or you bumped something, the first thing that you will do is to try to cover your body and do deep pressure. This pressure is regulating and like calming for the body. So let's start with the proprioception processing differences. What if the child was under-responsive for proprioception? I want you here to remember the big cup. So we have a minimal amount of sensory input and the child didn't meet the needs of proprioception. What will happen here is the body will have like poor awareness of body position. The child could bump into people, into furniture, or even to balls, the child will have difficulty judging how much force to use during play. And a very common example here that the child will not be able to put enough pressure on the pencil, for example. Some children are doing very loose pressure on the pencil, while others are doing very heavy pressure on the pencil. It could be even broken down. The child will appear floppy, slouched, or with low muscle tone, but it's not about the muscle tone, it's about the sensation. Also, the child will lean on furniture or people, or will always ask for hugs and deep touches. And also, another example here, the hyperactivity. If the child is seeking extra movement, that means this is because of his sensory difficulties. Okay, what about if the child was over-responsive to proprioception? The cup is small and the sensations are too much. First of all, this sensory processing difficulty isn't not very common. It's not very common, but it happens sometimes. So the child will be sensitive to body sensations, will avoid the playground, uses movement carefully and with caution. The child also will appear stiff, tense, and sometimes they are walking heavily. You will feel like they are moving the feet very heavily while they are walking. And they will avoid the rough play, and usually they become very anxious with any physical challenge. So as an OT, what we can do to support them, not only as an OT, everyone can do that. Heavy work activities, which I really love, which I really like, and it's making a changes. It's really very beneficial for the kids. Anything with pushing, with pulling, with carrying heavy items will give the kids this sensation of proprioception, and it will help them to be more regulated and more calm. Anything with resistance, with pressure like Play-Doh, squeezing balls, bowling pins, and also body awareness activities like obstacle course. Obstacle courses also is a very, very good thing to do in therapy or in like with your kids at home also. Because when you ask the child to move and to pass an obstacle, here you are working on motor planning, and at the same time, you're giving enough sensations to the body. Deep pressure, like firm hugs, blanket wraps, yeah. And now let's move to the vestibular processing differences. If the child is under-responsive, the cup is big. Here, the child will need a lot of movement to feel alerted. They will move, they will rock, they will do spinning, they will seek fast or intense movement, they will appear not dizzy, they will not feel dizzy easily, and definitely they will have a poor sitting tolerance. It will be not easy for them to sit for long times. And if the child was over-responsive to vestibular system, it will be completely the opposite. He will find the movement uncomfortable, threatening. They will avoid these swings, slides, climbing, jumping. They will become anxious with any movement or with any height. For example, walking on uneven surface will be a big challenge for these children, and they will get dizzy easily, and they always prefer to put the feet on the ground just to feel like more supported and more balanced. And they become very upset with any unexpected movements. So OT strategies to support these children. If the child is very sensitive to movement, we have to start slowly with the kids. We have to take it gradually. We will just introduce the movement, but if the child accepts that, if they do want to move, we have to stop that. If they are accepting that, we can start with very gentle movement back and forth. We can start with linear movement. It should be slow, it should be rhythmic. If the child accepted that, we can move to the rotatory movement. This is a bit complex comparing to the linear movement. If the child is accepting the rotatory movement, Here we can move to add more challenge to the balance system. For example, instead of just sitting on the swing, we can ask the child to stand on the swing to balance himself and to do another activity at the same time. For example, I can give the child like a clip to fix it on the swing while he's standing. Here he is challenging the balance more than the other skills. And use predictable and gradual movement. As I said, if the child feels not happy with sitting on the swing or participate in like outdoor areas, slides, we shouldn't enforce them. It's very it's very aversive for them. So we have to take it just slowly and one by one. And always support the body security. For example, if the child is sitting in the classroom and his feet isn't touching the floor, it's recommended just to put something behind the feet. At least he will feel that he's safe. His feet are stable and his body is stable. Here, I think they will participate much better. And offer movement breaks in case it was the child hyperactive and seeking extra movement. Here we have to give them these sensations, but in more structured way. For example, I can take the child, let them swing, for example, 10 times, then stop, then do another activity, then go swing again. Here the child is satisfying themselves with this movement, but at the same time, it's structured movement. It's not random. And let's move to the tactile processing differences. If the child is under-responsive, they may not notice the touch easily. If there's mess on their hands or the face, they will not notice it. Sometimes the child will seek extra touch, like rubbing object or touching everything, playing with everything. And usually they have high pain tolerance. So if the child like bumped or fall down, they will not cry, or maybe they will not notice that there is any painful stimulation. They may not, they may appear like unaware of the personal space. They can like bump to other people easily, bump to the furniture. They appear like a bit clumsy, we call it, that they are not like well coordinated and well organized. So if the child is over-responsive, here the child will avoid the touch. It will be completely the opposite. They will be very sensitive. They will avoid specific textures, or for example, in our like clothing, we have the internal tags. These could be really aversive for them. They will dislike to be touched or hugged or like touched by other person. And the pain tolerance will be like very low. So with any small stimulation, the child might react more than the normal situation. It could be processed as something painful for them. And sometimes they are avoiding the messy play, avoiding the painting, sand, playing with the glue. Usually, if the child is over-responsive to tactile system, they will hate the wet texture. So playing with slime or touching food like banana, for example, that will be very for them. So what we can do to support children with tactile processing disorder, we have to do regulation before the exposure. As I told you already, the proprioceptive input is very calming and regulating to the body. So before give any touch to the child, we can just do a fair or deep pressure on their hand in order to accept the touch more. And actually, it's working. I have tried with so many kids. When you give the proprioception input first, they will accept the tactile input much easier. Also, we have to maintain like predictable transitions. We cannot just expect the child to participate suddenly in one activity that needs touch or overexposure to tactile system. So play-based tactile exploration, as I already mentioned, we have always to start with something dry. Then we can move to the semi-wet touch, and finally we can go to the wet touch if the child is already accepting the previous things. And we have to use some tools. For example, if the child is doing painting and we don't want the child to touch the paint, we can give them like a painted brush to help them more accept participating in the activity without being like overwhelmed. One example here, I had like one child who was very aversive for cutting the nails and combing the hair. So what I was doing is take every single finger, do deep touch for the finger, like around 10 seconds, and then do the cut nails. And it worked very well. It's really helpful to give this input before just do the self-hygiene or combing the hair or cut the nails. So we have also to do environmental modifications. As I already mentioned, we have to remove the clothing choices because remove the clothing tags because sometimes it's aversive. And we have to offer the children the specific fabrics if they prefer the soft fabrics or they prefer another fabric. It should be taken into consideration just to help the child to participate better. And as I already mentioned, also, we have to avoid the unexpected touch and prepare the child before the messy play and grooming tasks. Now let's move to the oral sensory processing differences, and it's very common among children with autism. If the child is under-responsive, the cup is very big. The child may have reduced awareness in the mouth area. Sometimes they are seeking specific flavors or some textures. Also, one common thing that they are doing, they are overfilling the mouth when they are eating. And sometimes they are keeping the food inside the mouth without chewing and without swallowing it for so long times because they are not registering this feeling. So it's okay for them to be in the mouth. And sometimes they are chewing everything, even if it's non-food items. They are chewing toys, they are chewing pencils, clothing, anything. One thing that I have to mention, the oral area is the problem could be happen from proprioception system, or it could happen from the tactile system. How can we differentiate between them? If the child's mouth was all the time open and they are not noticing that they cannot close the mouth, here we can say that there is poor proprioception in the oral area because this is not easy to control, to open and close if you don't feel this area. Okay, what if the child was drooling all the time? Here we can say it's tactile issue because they're not feeling what's happening in their mouth. They are not feeling the mess or anything in their mouth. So if we understood what is the exact reason of this oral sensory processing difficulty, it will be easier for us to choose the appropriate strategy to work with the kids. And if the child is over-responsive, this is very common as well. They might gag easily. They will avoid certain food. They will be very sensitive to oral sensations. They will avoid the brushing, the oral care, and they will refuse the mixed textures. The child, for example, can eat the rice and can eat the yogurt, but if you mix them together, it will be overwhelming to them. And they will give a very strong reaction to taste, to temperature, and most of the time they will be a picky eaters. So what can we do to support these children? We can offer appropriate oral input. If we understood what is the reason, as I already mentioned, for example, if the child has difficulty in proprioception, we can give the deep sensation. We can do a deep massage to the oral area from inside and outside the mouth, we can give them some items to bite with gradual force input. And if the problem is tactile, we can just put some different textures on the mouth gradually to help the child identify these inputs and react to it accordingly. There are some different activities, like for example, to increase the oral area awareness, we can use straws, we can use whistles, blowing games, or sucking activities. All of these activities are giving some resistance and pressure to the oral area, and that's why it's improving the oral awareness. We have to respect the oral sensitivity if the child isn't accepting to use any like for example, hygiene, toothbrushing, we have to take it slowly and gradually. We have tried to think about alternatives, use another tools. It could be like more accepted to the children, but we shouldn't, enforce them to clean their mouth or to use a specific tools because this is very hard and aversive for them. And now let's move to the auditory processing differences. If the child is not is under-responsive to auditory processing, they might not notice the sounds, might not respond to others, they will not respond to their name, they appears like not aware about the background noises. Sometimes if the child is under-responsive, they are singing and producing some vague sounds. And this is very common in autistic children who are like always singing, always singing. Sometimes it's because they are seeking this auditory input, so they are enjoying that. And if the child is over-responsive, this is also very common. They are trying to avoid the busy environments, covering their ears. They become very distracted if unexpected voice came suddenly. Yeah, that's it. They avoid generally the crowded places or loud areas. OT strategies to support the auditory processing. First of all, we have to respect that thing, and we have to give them like some auditory breaks if the child isn't happy in the busy environment, and we have to take him out from this environment. Why not? At least he will be more regulated and he will accept to go again and participate in other activities. We have always to reduce the background noise. We have also to use a clear and predictable verbal inputs. We can't ask the child to do so many things at the same time. We have to take it slowly, go to the child's level, look at their eyes, and give the instruction in a very simple way. So if the child didn't understand or didn't receive this auditory input, here we have to move to the visual input. We have to give something additional to help the child to respond and understand. And support listening skills gradually. As I said, we have to take it very slowly. Start with very simple orders and with familiar orders with the kid, and gradually we can increase the complexity. Visual processing differences. If the child is under-responsive, the cup is very big. They may not notice the visual details. They will have difficulty in noticing the item, appear unaware of visual cues or instructions. Here, definitely you will find difficulty in reading and writing because it's mainly depending on the vision. So if the child is having difficulty with identifying the visual inputs, it will definitely affect their academic skills. And they will find difficulty in finding items. Sometimes, even if the thing is very clear to them, for example, give me this thing from the table, they will not find it easily because of this difficulty. And if the child is over-responsive, they will be very sensitive to any visual input. Sometimes they will not happy to go if in the summer, let's say, because the sunshine is very intense at specific hours, let's say from 10 to 12, they will find it too overwhelming and too stimulating for them. And here I just want to mention that some kids are doing the like the corner gaze. They cannot look at you directly because of this difficulty. Sometimes looking directly to the thing is very intense, is overstimulating. So if you just use the corner gaze, it's like less distracting and less aversive, let's say. We can also observe that children like closing their eyes. So what we can do to support these children, we have to reduce the visual clutter as much as we can. If I'm working on a specific goal with my child, I have to remove everything else from my table, just keep the thing that I'm working on, because putting so many toys on the table would make the child over-responsive and overwhelmed. They cannot attend, they cannot focus if the visual information are too much on the table. Also control the lighting. It's all about trial and error. You can try just turn off the light. If the child is happy with that, you can do it. Sometimes I'm using the spotlight with the kids to put it on a specific area to help the kid to focus as much as I can on the thing that I'm working on. And it's working also. Use clear visual organizations. Try to be organized as much as you can as a parent or as a teacher or as a therapist. Put labels, put everything in a specific place and keep it away. If you want to use it, just bring it. And highlight the important information. For example, if you're working to improve the reading skills for one child, it's very useful to use highlighter because the highlighter will just make the information very clear and obvious, and the child could read it much better. Support visual scanning and tracking. There are so many activities to improve visual scanning and tracking. One simple activity is to use the pencil and move it and ask the child just to keep the focus on the pencil. The olfactory processing differences, which is the smell. I'm not going to just cover this. It's almost the same. If the child is under-responsive, they will just smell everything around them. If they are over-responsive, they will be like very distracted by the perfumes or the intense stimulations. So here, let me talk about the adaptive response, which is a very important concept in sensory integration. Adaptive response means a successful response to an environmental challenge. I'll give an example here about a child who's trying to ride a bicycle. Riding a bicycle is a very complex skill, and the children will not succeed from the first time. It needs a lot of trial and error. And with each time the child is practice this activity, the body will adapt, the body will be integrated just to help the child to be successful in this challenge. But the child have to be active. What if I took the child and put him on the bicycle and tried to let him ride? Maybe he will learn, but it will take longer time, and it will not be like when the child is trying to do the activity because of the internal motivation for them. An appropriate supportive environment can encourage it, and this is what we are doing in occupational therapy. We are trying to structure the environment and structure to activities to help the child to succeed in it. We're not doing the activity passively. We're trying to encourage the child to be as active as he can in order to learn and to succeed in adaptive responses. And these adaptive responses over time is creating like a permanent change in the brain, which is called the neuroplasticity. Our brain has the ability to change, to like learn a lot of things, to learn a lot of skills. But the child should be active, and also the child should do these activities repeatedly, again and again and again, in order to create these permanent changes in the brain. And also we can eliminate some skills which is unwanted, or some behaviors which is unwanted for the kids, if we just ignore it and focus on the things that we really want the child to learn it and to do it. Now, generally, most changes in the brain happening in the young age, but still it's happening with all ages throughout the life stages. Here, I want to just talk about classical sensory integration therapy. Classical sensory integration therapy isn't like only a sensory activities to do it with the children. First of all, it should be individualized to each child. We cannot do the same therapy for two children, even though if they have the same diagnosis, same sensory patterns, same preferences, it should be individualized for each child. It should be also balanced between structure and freedom. We cannot let the child play like randomly in the place. We have to structure our environment to facilitate their participation. It should be child-directed. That means the child should choose the activity. And I usually love to start my session with asking the child, what do you want to do today? Because if he chose something, the therapy process will be smoother and easier. And whatever the child chose, I will just build more challenge for this activity to let him learn another skills and to improve their skills. And yeah, as I said, it should be from the child inner drive. It should be just right a challenge. We cannot do something very hard, so the child will be disappointed and upset. And we cannot do something very easy where the child will succeed directly. We want to create a bit of challenge in order to increase the motivation for the child. Sometimes we have to use some passive activities like brushing to the kids, or doing joint compression or the linear swinging, but we shouldn't rely on them all the time. It should be just a part of the therapy. Otherwise, all of other activities should be actively done by the child. And also, the sensory input must always be paired with a functional task. For example, I can ask the child to pass an obstacle course, but at the same time, I will just put puzzles and ask the child to take one puzzle, pass the obstacle course, and then fix it in another place. I don't want the child to be moving randomly without any purpose. Something else should be paired with this activity as well. Or if the child, for example, is jumping to increase the self-regulation, I can ask them to jump 10 times, stop, let's play ball together, throw the ball, receive the ball, then jump again. Anything that you can do, you can be as creative as you want, but you have to pair these activities with a functional tasks. And here we're talking about the differences between the sensory integration and the sensory-based interventions. Actually, all sensory integration therapy is sensory-based, but not all sensory-based activities are sensory integration. So sensory integration is a different thing. It's like a curriculum. It's like a full program. It should be done for each child, as I told you, individually. It's focuses on how the brain processes the sensory input. It uses play, it's child-led activities, it's just right a challenge for them. And the aim for the aim for sensory integration therapy is to create a long-term changes through neuroplasticity. We're doing that just to reach for a specific goal, not randomly. We cannot do, like, for example, one session per month and say this is sensory integration. No, it's not like that. Sensory integration, it should be a full program minimum of 2 years, minimum of 2 sessions per week in order to achieve this long-term changes in the brain. And also it should be implemented by a trained occupational therapist or a certified speech therapist as well. But sensory-based interventions, it could be any activity or tool or strategy that includes some sensations like playing with sand or doing painting activities. It could be done by anyone, could be done by teacher, by parent, by anyone literally. It supports the daily functioning and participation. The aim is to improve the regulation in the short-term period. So if the child is like overwhelmed or not happy, we can do any sensory-based activity with them in order to let them be more regulated. It doesn't require a challenge. You can do as simple activity as you want. For example, as I already mentioned, we can put some animals inside the sand, inside the sand pool, and ask the child to find this animal. This is not challenging, but it's also beneficial for the kids. And that's it. This is the conclusion, guys. And what I really want to just take out from this presentation, as I already mentioned, that I want you to create like a mindset shift about the children behavior, accept them. I believe the knowledge is a power. If you understand what's happening with the kids, that will really help you to be more patient with them, to try to support them as much as you can. And that's it. If you need to ask anything, please feel free to ask me. Is there any question? Okay. Okay, we're done, guys. If you want to leave, feel free to leave. If you have any questions, I'll be here for a few more minutes. You can just ask me. Yes, Maha.
Thank you, Sawsan, for this presentation. It was very useful. I wanted to ask, can a child have more than one, like you mentioned, hyper and hypo sensory. So can a
Yes.
child have, for example, he's high on vestibular but low on oral, and so if you can explain to us.
Yes, definitely. Actually, each sensory system in our body has different threshold. And even though with the same sensation, sometimes you will be seeking extra sensation and sometimes the child will avoid. Even if the general pattern is a seeker, for example, sometimes you will feel that they are avoiding the sensory stimulation. So it's a very non-fixed thing. It depends on very different factors. Does that help, Maha? Did that answer your question?
Thank you very much. Thank you very much. Yes,
Welcome, my
yes,
dear.
very much. Thank you.
Any other question, guys?
Hi, Sawsan. There are some questions in the chat box. Maybe you'll have to answer them.
Okay, let me check. Can you read it for me, Catherine, please? Oh, okay, wait.
Yeah, sure. So, one has asked like how to differentiate between stimming and corner gaze.
And
Corner gaze.
actually, there is no specific pattern where we can say this is a corner gaze or this is a stimming, because the child themselves, they might stim if they are like not well regulated for a specific reason, but at another times, they will, actually, they are different things. The corner gaze, it's something like related with the intense vision, right? Stimming, usually the child might like seek the vestibular input or seek the proprioceptive input. In the corner gaze, it's about actually avoiding the visual input. So they are two different things.
So the next question is, how will you know if the child is seeking, like for example, in the swing, or just like to playing in the swing to avoid other activities?
Okay. Now, generally, if the child is seeking movement or any other sensation, this should be consistent for very long time in very different environments. So the child will seek the movement inside the school, inside the house, in the general areas. It's not something just done for avoiding task or done like once per day or once per week. It should be very consistent with the child. And you can notice also if the child gets dizzy easily or not. You can try, for example, the spinning. Now, spinning is like overstimulating. You will feel dizzy after spinning. If you try the spinning with the hyperactive children who are seeking the extravestibular sensation, they will still feel like not dizzy. You can look at them, you can look at their eyes, they will feel like they're okay. They can spin again and again and again, right?
All right. So the next question is, how can you address the biting of a child? What are the strategies for those behavior?
The biting?
Yeah.
Okay.
Maybe they're asking if this child of mine keeps on biting, is it a sensory or is it a tactile? I think they wanted to ask what strategies could be used to regulate.
It could be a sensory difficulty for sure. The child will seek like the extra proprioception input while they are biting, because biting is an intense movement. It will just give sensation to the oral area. And also the child might have like a high pain tolerance. So whatever he did for himself or hurted himself, he will not feel the pain, okay? But always also notice what are the trigger of this behavior. Is it because the child is overwhelmed by tasks or trying to like to avoid doing something specifically, or it's done without any other reasons? Usually these children cannot like express their emotions and express their needs easily. So they found always another ways just to do it, to feel more calm and more regulated. What I will just ask you to do is to try to block the child, definitely. Try to block them to not hurt themselves or to not hurt himself. You can just cover the hand with like long sleeves shirt, or you can use like resistant bands, just pull it around the wrist, for example, and always observe the child. Whatever you want to try, always observe what's the reaction. If the child is happy with the child isn't comfortable with that, then we have to think about alternative activities to try to support them.
Yeah, thank you, Sawsan. So there are two more questions. One is, can you give an example of how we can form intervention goals while applying sensory integration? I think it's a complex question.
Actually, it's a bit complex because, as I said, it should be done under a certified occupational therapist. Sensory integration couldn't happen with not certified therapists. It's very complex. And there are so many assessments to do with the child and so many trial and errors. As I already mentioned, It's not like a fixed schedule or a fixed thing to follow with everyone. It's really depending on the child, and it should be done after a very comprehensive assessment for the child.
All right, the last question. So often children show signs of constant open mouth with drooling. So that is it a tactile or a proprioceptive issue?
Open and drooling together?
Yeah, constant open
Yes.
mouth with drooling.
It could be poor oral awareness for proprioception and tactile at the same time, because proprioception, the open mouth, is a sign of a poor proprioception in this area. And the drooling is a sign of the poor tactile sensation in this area. See, so it could be both things together. You just try to improve the awareness in this area. Do deep massaging, as I already mentioned, from outside, from inside the mouth. There are some specific tools. It's like the sponge. Actually, I bought it from Timo, and I found it helpful to ask the children to just put it in mouth and do specific movements, doing some linear movement with the sponge inside the mouth, doing like fast movement just to stimulate these sensations. Also, you can try to let the child eat different textures, eat different like a chewy food, a drink, for example, heavy smoothie. All of these things will really help to improve the oral sensory awareness.
All right, Sawsan, that's all. That's all for now.
Okay, thank you so much, everyone, for your attending. And if you want to ask any other question, please just reach out. You can ask for my email and send me anything, and I'll try to support as much as I can. And see you.
Thank you.
You're most welcome. Bye-bye.
Sawsan, this was very informative.
You're most welcome. Thank you.